Tell me, at the core of your innermost self, what is it that you truly desire? Is it more connection, more closeness, more intimacy? I believe that inside every human being is that need to feel closer and connected with ourselves and the ones we love. Oftentimes, physical, emotional, and cultural obstacles get in the way. My guest today is going to help us explore this beautiful topic of intimacy and how we can meet ourselves and our partners in that space of fulfilling heart-to-heart connection. Welcome to Pleasure in the Pause, a podcast dedicated to inspiring midlife women to feel more connected to their bodies, pleasure, and power through perimenopause, menopause, and beyond. I am your host, Gabriella Espinosa, midlife and sexual wellness coach, and it is my pleasure to be here with you. My guest today is Dr. Sadaf, a board-certified gynecologist with an expertise in sexual and menopausal health. She is also an intimacy coach and supports women to explore their ideas and beliefs about sexuality and what they think it should be, in addition to empowering them to create the sexual intimacy they crave in their relationships. We dive deep into the question, what is intimacy? And explore a beautiful practice called Sensate focus to deepen that sense of connection with yourself and your partner. Welcome, Dr. Sadaf, to Pleasure in the Pause.
Well, thank you so much for having me, Gabriella. I really appreciate your time. Thanks so much.
It is my pleasure. I'm really excited about diving into the ways we can deepen intimacy. I truly feel at the core of every one of us is the desire to feel closer and connected with the ones we love, with people around us. So I feel it's a beautiful topic to explore. So thank you so much for being here. You bring this very interesting lens as a gynecologist specializing in menopause and sexual medicine, and also as an intimacy coach. Not many doctors train in the field of coaching, and especially intimacy coaching. I would love for you to share with our audience why you chose to marry these fields of medicine, sexuality, human psychology, which is at the core of coaching in the work that you do.
So the reason why I did that is because I found that there was a huge void. I felt like there's so many practitioners out there that practice sexual medicine and menopausal medicine, but we often forget that the biggest sexual organ actually is the brain, right? So we can take care of all of the anatomical problems and, help somebody with vaginismus and help somebody with decreased libido. But what we forget is that so much of it has to do with our thoughts and what we're thinking and how our relationship is going. And if we don't work on that first, then I think we can take care of everything else anatomically and still that person not be completely satisfied. And so I think that it really starts with the brain and working on the thoughts and the feelings and then the actions that result because of our thoughts. And so that's why I wanted to combine all of this, because it's rare that you find somebody that can combine both the medical aspect of it, but also the psychological component of it. And as you know, in sexual medicine, we always work with a biopsychosocial model. And so we not only address, biologically what's going on with the person, but of course we have to assess psychologically. And that's where all of these great authors that you've had also on your program, Dr. Lori Brotto, I saw that she was on one of your episodes and she was kind enough to come on one of my episodes as well. And she's amazing. And she talks about how mindfulness can lead to better sex. And actually, I think that was on one of the New York Times articles for increasing intimacy.
Mm-hmm.
So I think that a lot of us, because we're so focused on the medical aspect of it, don't really go back to consider what else is going on with the patient.
Yeah, that's been my experience as a patient, and, all respect to doctors, right? I come in and explain what I'm feeling. And yeah, your job is to focus on the symptomatology. But especially as we're moving through menopause, and especially as we're experiencing a decline to our libidos, I do feel there is a psycho-emotional aspect to that is really difficult for doctors to address. They probably don't have the training. And I think it's such necessary training. And it's difficult, right? I've had encounters with doctors where I just don't feel comfortable talking about sex with them, and they don't either. So where do you usually start the conversation with a patient who comes to you and wants to talk about her libido or where she is in her sexuality?
Absolutely. So thank you for asking that. So, usually what I do is so in the clinic, when I see patients, patients will come in for different things. They could be coming in for painful sex, right? That could be their chief complaint, or it could be that they have decreased libido. It could be any of those things. So, what I start with is we usually ask the typical questions of, any medical problems, surgeries, blah, blah. And we go through all of that. And then as they're talking to me, then I realize that there's more to it than what they're telling me. So, for example, I have a patient that came to me for painful sex. And as I started to talk to her, whatever, she told me that I was the third physician that she was seeing. So she had come to the clinic, she had seen two other physicians. And every time she came in, it was painful sex. And all they did was prescribe her vaginal estrogen because she's perimenopausal, now going into menopause. And, vaginal estrogen, I love vaginal estrogen. Vaginal estrogen is really like liquid gold. I mean, absolutely every single woman needs to use vaginal estrogen until they die, really. And it's going to help with, lubrication and the anatomy, and also with help with some of the arousal. But what they didn't address was what else was going on with her. And so she said, she used the vaginal estrogen. It didn't do anything. She's still having the pain. And every time she has sex with her husband, it feels like he's hitting a wall and it's just painful and she doesn't want it anymore. And before this, by the way, I should say that she didn't have any problems. So she only noticed a problem. She didn't have any issues with libido or anything like that prior to this problem right now. And this problem had been occurring now for the last 6 months is by the time that I saw her. And so she just was, at her wit's end. She didn't know it was affecting her relationship, all this stuff. So then, after I examined her, I noticed that not only did she have a little bit, of course, as we all go through perimenopause, menopause, you have a little bit of this vaginal atrophy, but not only that, she had something called lichen sclerosis, and nobody else had addressed that. And so I took a biopsy. We confirmed that it was lichen sclerosis. So then I started to treat her for the lichen sclerosis, and it started to get better. So she needed the vaginal estrogen, but she also needed the treatment for her lichen sclerosis, which we started to do. But then she had the secondary issue of vaginismus now because she'd been experiencing pain for so long that now the muscles in the vagina started to tighten up anytime her partner would initiate intercourse, penetrative intercourse. So what she realized was that, and it was only after she and I started talking, was that because she'd been having this pain so long and she felt like she was being ripped up every time she attempted to have intercourse, that in her mind, she already started to anticipate pain even before anything had even started, right? So it was the anticipation of the fear. It was that it was going to hurt. She was afraid she was tearing, all this stuff. So because of all of these things, her muscles in her vulvar region, in the vagina, began to tighten. So the muscles around the vagina were starting to tighten up. So that's why she felt like her partner was hitting a wall every time he started to have intercourse, because those muscles already tightened up before they even started to do anything. So even when I tried to examine her, it was the same thing, that her muscles were tightened up so much because of her anticipation of pain. So what we had to deal with were, a few things, right? We had to deal with the atrophy that she had because of perimenopause, menopause, the vaginal dryness, the irritation, all of that. So that was a vaginal estrogen. Then we had to deal with the lichen sclerosis. And, I know that there's so many telehealth companies, and I think it's fantastic that we're doing so much telehealth for menopause. But, it's that human touch that you don't get with telehealth. And it's the examination that you don't get with telehealth, that you only in-person provider. So it was the lichen sclerosis that would have went undiagnosed if she just did telehealth or went to somebody that wasn't able to examine her. So we dealt with the lichen sclerosis, but then we also had to deal with her thoughts, right? And so now that her pain was starting to be relieved because she was getting the proper treatment and her lichen sclerosis was starting to improve. So now she didn't have this fear, and she could also feel that the skin was more elastic, that it would stretch without the pain. So now that she was starting to find that she was starting to heal, she wasn't anticipating that pain that she initially was when she would have intercourse. So then she started to relax a little more. She started to use breath work a little bit more. She was able to talk to herself and tell herself that it wasn't going to be as painful as she had thought before and that things were starting to improve. So that's how working on not only the physical component of what she came in for, but also the psychological component of what was causing part of her pain with intercourse really was helping her to move forward. So, that's just one of the ways. And we know with vaginismus, you also need to use dilators. You work with a pelvic floor therapist to help you, but also it's that huge psychological component that is so key with vaginismus to help patients move forward.
Wow, what a fascinating case study. Thank you so much for walking us through that. I don't think I've ever had a doctor walk us through a case study like that. And there's so much there. There's so much there that I want to unpick. I had on the podcast on episode 15, Dr. Maria Uloco, and we talked
Oh,
about
love
this.
her.
Yes, we talked about this issue of how so many doctors aren't trained in vulvar health. And yeah, you'll explain a symptom and they'll just give you a prescription for vaginal estrogen when there may be something else going on there, but they're not even doing a vaginal exam, a vulvar exam. So how can they know? And I love that you take this initiative, this sort of you put on your sexual medicine detective hat and you go a little bit deeper, because we should get a vulvar exam. If I'm going to get prescribed vaginal estrogen, I want to know that there's nothing else going on there that the vaginal estrogen is going to perhaps cover up or hide or not resolve.
Yeah.
And then also you talked about this sort of magic bullet that people think vaginal estrogen could be when there are other things, as with hormones in general, right? I love hormones. I love hormone therapy. They've been, a game changer for me, but they are not the magic bullet. You do have to focus on so many other things, especially when it comes to your sexuality, your thoughts, your relationship, how you communicate. And I so love that you have this broader perspective, not only of the physiology of sexuality or sexual symptoms, but also of the psycho-emotional or psychosocial aspect, which is so, so key. I know that you are a member of Ishwish. Many doctors have recommended Ishwish, and I want to just do a shout out to them again. We're going to talk about your practice. So if women are in the New York area, they definitely have to come and see you. But if they're not in the New York area, seeking a sexual medicine expert who's been educated under Ishwish or a member of Ishwish. And yeah, also to your point of the pros and the cons of telemedicine, right? So being able to see someone in person. I love the type of concierge service that you offer. We're going to talk about that in a little bit, but let's go back to another topic that I'm very interested in exploring. And this is the narratives of our culture or family of origin and how they shape the way we view our bodies, our sexuality, and how we show up in the world. I know that you are of Pakistani heritage.
Yeah.
So I'm curious, what are some of the narratives that you grew up in? How did they influence your view on sexuality and your decision to pursue this fascinating field of sexuality and intimacy in your work?
Yeah. So as you stated, I'm Pakistani, and definitely I, grew up in a very conservative community where women, honestly, I didn't really have those female role models. Growing up, and I always felt that women were kind of in the shadows. And of course, Pakistanis are not a monolith, and definitely there's so many women out there making huge differences. But I'm just talking about where I was raised and, what I saw. And what I saw was that there weren't too many women in the sexual health field. I only knew of one of my mom's friends that was an OBGYN. And when I was looking to get into OB, she told me not to do it, which I
Mm.
think most OBs will tell people not to do OB just because the lifestyle is so rigorous. But, I really wanted to understand what the stigma was. So many of us, and I can only speak for myself, really were raised in perhaps a sex negative environment, right? And where sex is wrong. It's not wrong, but I mean, it's really just only, of course, in the context of marriage for my culture and religion. And it's also, there's shame. It's a taboo. You don't really talk about it. You don't really talk about it with anyone. In fact, I did a TED talk. It's called Sex Education Lessons from a Muslim Gynecologist. And I talk about how, like, even on my wedding day, my mom assumed that I knew everything about sex because I was, I just finished my residency in OBGYN. And so my sex talk was she just, it's my wedding day. She comes into my room and she's like, "So it's you're getting married today?" And I was like, "Yes." And she's like, "Okay, I guess that's it." And that was it. That was my sex talk. There was no sex talk. So I mean, I was like, wow, I if I didn't even go to, do this residency, I wouldn't even have an education about like human anatomy. I mean, I don't know,
Mhm.
but I also talk in there about how in med school we don't receive any education on sex.
Mhm.
We don't in residency, in OBGYN residency. Now it's changing, and there's the first fellowship for sexual health in after OB out in DC. But before that, I mean, honestly, there was nothing. I learned nothing. In fact, a few years ago, about 3 years ago, I was working with an academic hospital and was part of their residency program. And there they didn't talk about sex. Nobody talks about sex. So there's really no sexual education that we're getting as physicians that I know of. I mean, I think that urologists perhaps are the only residents that get anything at all about sex education. Most physicians do not. Most physicians are pretty uncomfortable with the topic. And so you really have to find and go to a doctor that feels really comfortable talking about sex and the nuances of it and all the things that can happen to really get proper care if you're having some type of, say, female sexual dysfunction. So for me, it was really a journey. And I have to say that it took me a while even to feel comfortable talking about sex and really learning about it. So what I did is I took the year-long course through the University of Michigan for sexual counseling and education. It's offered to healthcare providers, and usually sex therapists are the ones that take it, but there's a lot of physicians that end up taking that course as well. So I did that year-long course, which really opened up my eyes to the cognitive behavioral side of sexual medicine. I think if I didn't take that course, because there are so many therapists that take that course, we talk a lot about the psychosocial aspect of sexual medicine. Also, we had speakers that talked a lot about it. That's where I first heard about Lori Brado. That's where I first heard about Rosemary Basson. Rosemary Basson is actually going to be on my podcast. We're going to talk about the female sexual response cycle, all of those things. I mean, I, wouldn't have heard about it otherwise. So I did that. I did coaching through Rutgers, and then I combined the two, and then I became an Ishwish Fellow. So a lot of just kind of legwork on my own just to get the education that I never had.
That is amazing. And gosh, thank goodness we have doctors like you who take that initiative to empower themselves with more knowledge. It seems like you're so in touch with your patient population, knowing what their needs are and knowing that you need extra skills to serve them, right? I walked into doctor's office who dismissed me, or they think, I need to just listen to them because they know everything. And you're admitting to the fact that not all doctors are trained in sexual medicine,
Yeah.
in vulvar health, and this is in coaching and looking at the psycho-emotional aspect. So you're really, I love this. I love how your practice and your mission is to really elevate the practice of medicine. We need more doctors like you, Dr. Sadaf. So thank you for all the work that you're doing. I want to move on and talk about intimacy.
Yeah.
I love intimacy. I
Yes.
love talking about intimacy. How do you define intimacy?
Yeah, I think intimacy to me is the ability to be vulnerable with somebody. It's that connection that you have, whether it's, and there's so many different types of intimacy, right? There's emotional intimacy, there's intellectual intimacy, there's experiential intimacy, and of course, there's physical intimacy. So many different types of intimacy. And I talk about that a lot. In fact, I have a podcast episode where I talk about revitalizing relationships and, revitalizing the intimacy. And I find that there's so many ways to do that. We forget, we think that, everything costs a lot of money, that it costs a lot of time, and it really doesn't. All we have to do is really just make the effort and be more, I know that mindfulness is a buzzword, but really just being present in the moment, right? Just focusing on the moment that you're in right now. And I was just reading, and it talked about how practicing mindfulness reduces anxiety because you're focused on the here and now, right now. you're not thinking about the future and worrying about the future and causing stress. You're not worrying about the past, what happened. You're not ruminating over thoughts of perhaps something that you had done wrong. Instead, you're just focused on the present. And just by doing that, you can decrease anxiety. In fact, if we wanted to increase intimacy in our relationship, what we would have to do is just really just be intentional, focus on that person. But really, you could go outside for walks. You could hold
Mhm.
hands. You could share a 6-second kiss. The Gottman Institute talks about that and how that, really helps to revitalize a relationship, really just focusing on that. I know that you and I talked a little bit offline about Masters and Johnson's work on Sensate focus and Linda Weiner's work on that. And again, I really attribute what I've learned about sexual medicine through the University of Michigan because I've learned so much. And, Linda Weiner's work is amazing. She has a workbook on Sensate focus. She has I did a webinar with her this past March that she hosted, and I was, totally fangirling on her because I think her work on Sensate Focus is amazing. And, I did a podcast with her. She was on my podcast as well. And we talked about Sensate Focus and how that really helps. But going back to how to increase intimacy, I think, even cuddling on a couch,
Mhm.
sharing dinner, making dinner together, simple things like that. I think it's really just about being intentional and making the time for somebody, right? We all get so busy with our lives that we forget that our partners, our spouses require attention as well. Everything requires work. And, but it doesn't have to be hard work. It can be easy work, right? It's just
Mhm.
about spending that quality time where you put away your phones and you make them a priority in your life. I think that people get really turned off by scheduling date nights, but I think that, date nights are actually really important because that's the day or the night or whatever that you decide that this person is a priority in my life. And I'm just going to focus on them. I'm just going to put away my phone. I'm just going to, put all my attention on them. And I'm just going to focus on what they're saying and what they're doing and show them that they mean a lot to me.
I love that idea of intention and making time. And oh gosh, I just cannot talk enough about this. Those two things have made such a difference in my relationship with
Mm,
my partner.
yeah.
Just saying, this is what we want to do. We want to experience more pleasure together. So let's set that for ourselves. Let's set aside a whole day. Let's set aside a afternoon. Let's go away for a weekend and
Um,
just make that intention to focus just on each other.
mm,
It's so difficult.
mm,
I know you talk about this on your podcast. I'm sure a lot of your patients are busy moms and it's so hard, or, busy corporate executives or both, trying to do both. And
yes,
it's so, so difficult to set aside that time and that intention when you're trying to do so, so much.
yes.
So what do you recommend for those people who just say, I don't have time?
I was coaching a woman, a physician, and she was just saying how she and her husband were totally off in terms of, when they wanted to have sex. She said, she felt she wanted to have intercourse at night or, become more physically intimate with her partner at night. And he preferred the mornings. And she just didn't know how they could connect anymore. And on top of that, she was tired and she's this and that, and she was a busy physician and that they just really weren't having those difficult conversations, right? And you and I know that one of the factors that decide whether or not a woman is sexually satisfied is the number one factor is communication. Is she able to communicate with her partner about what she wants, what she doesn't want, what her likes, what her desires are? And really, that was where the breakdown was for her. So, what I talked to her about and coached her on is just simply putting in her phone, whether it's like 3 times a week or twice a week, whatever, just time, even start out with 15 minutes, right? In your phone where you have that block time where you and your spouse have time to talk to each other and to connect with each other because he's a dentist, she's a physician, and they just weren't connecting anymore. And they have 4 kids and they were super busy. So what I asked her to do was just create that time, right? Just put it in the calendar, just block it off so that, and during a period of the day where neither one of you are super tired, right? Because if you're both super tired, you're not going to want
Mhm.
to talk. You're just going to want to go to bed.
Mhm.
So make that intention, make that time, and you just block it off. And then so that's where the conversation started. So first she made the intention to, have those conversations. Once they started to have those conversations, then they alternated when they were physically intimate, whether it was evening or morning or whatever worked for them. But the point was that they started out with communication. And a lot of times it's the communication that breaks down, then you don't have anything else, right? So she started with that communication. And then also what they did is create those date nights. And those date nights were super important as well, like we talked about, is that because we know that that was a time that they set aside for themselves. So starting out with communication, I think, is the first thing, and putting it on your phone, making it a priority, and then going from there.
I love that. Thanks. That's such great advice. And again, another wonderful case study of real people that you've supported. So, let me just take a little step back. So, in regards to intimacy coaching, do you work with women or couples? And is it separate from your practice as a doctor? And what are some of the issues that women
Right.
come to you with?
Right. So, that's a fantastic question because you're absolutely right. So, as a physician, we're not allowed to combine. So, they are two separate services. So, one is coaching, and one is, the medical aspect. So, those are actually two different entities. People usually, when they come for intimacy coaching, so I've had women come for vaginismus. And I think that was one of the bigger ones that I've had because we know, and we talked about this already, how there's a component of the physical aspect,
Mhm.
and also the psychological component to it. Decreased libido, right?
Mhm.
Again, when we start to have thoughts, and it all starts, like in medicine, I feel that what we end up treating a lot of times, like you said, were symptoms, right? People come in, we give, they tell us, they just want a pill. Everyone just wants a quick fix. I've had women come in and be like, I have decreased libido. Can I just get a pill? Is there something for that? Can I just get a pill and then I'll be fine? And then I'll say, I'll start asking them, I'll say, like, well, there is a pill. However, what else is going on in your life? Right? Like
Mhm.
what are the things that are happening that are causing you to have this, right? So again, I had a woman yesterday that was having a different woman that was having a lot of pain with intercourse. And so she said that she just felt that, and then of course she had decreased libido. So anytime you're going to have pain with intercourse, you're not going to want it, right? So anything that causes pain, you're not going to want, and it's going to become a chore. And it's like Emily Nagoski. I love Emily Nagoski, and I love her book, Come As You Are. But she says, I think in one of her TED Talks, that to want sex is to have sex worth wanting,
Yeah.
meaning like, you're not going to want something that's causing you pain, right? And so it's not going to be for you. So you have to figure out what is causing that pain. Is it anatomic? Is it psychological? Is it that your partner's not listening to you when you're talking to them, right? And they're just going for their own satisfaction and they're not worried about your satisfaction. So what is it? So when we talked to that woman, it was more about positioning and how she wasn't experiencing pleasure and that there was no lubrication and there was, so there were a lot of other things. It wasn't just that she had decreased libido. So when patients come to me, and they tell me I'm having decreased libido, I try to get to the root cause. And I just find that with this extra training of coaching, you really get into what is the root cause of the problem
Mm.
and really addressing that.
And how does that differ from sex therapy?
Yeah. So, with sex therapy, that's a great question as well. So, coaching is all about moving forward in your life, right? So, therapy is more about addressing, like, say, baggage that you've carried. For example, if somebody has grown up with sex negativity their whole life, that might be something that they want to address, what happened in the past. And then addressing those things in the past is so, so important. As you know, with sex medicine, the ideal triad is to have a sex med doc, to have a pelvic floor therapist, and to have a sex therapist all working together to help that one individual.
Mhm.
With sex therapy, you're able to delve into the past and kind of, uncover that and resolve those issues. But coaching is more about maybe you dip a little bit, your toe into the past, but really it's about moving forward. Like, how am I? So I grew up this way. And even so, say that I grew up sex negative, right? Even if you're not going to go 180 degrees to sex positivity, can you at least come to a neutral? Can you
Mhm.
get to that point? Because before you get to that sex positive part of it, you need to at least become neutral. and be open to it, right? There's been people that I've talked to about, their thoughts and things like that. And they're just like, well, no, that's not for me, about becoming a little bit more sex positive. They're not even open to becoming sex neutral, right? So they
Mhm.
understand that they grew up with these thoughts that that sex is wrong, it's shameful, it's dirty, we don't talk about it, it's taboo, looking at learning your own anatomy is taboo, it's wrong, it's a sin, all the stuff that they're not able to even come to a neutral spot where they can move forward, right? So you have to be open to that. And you have to also think about like kind of like your mindset, that we talk in coaching, this fixed mindset and growth mindset and all this stuff. But I think that for anyone that's listening, it helps us as human beings to have more of that growth mindset, because then we can learn how we can become better. And if something is not serving you, some thought is not serving you, then how do we go about changing that so that we can have thoughts that serve us, that help us to grow, to help us to become that better human that we want to become?
I love that concept of sex neutrality. I've never heard of it before, because one thing that I find, it's happened to me, it's happened to people I work with, the clients that I serve, is the resistance, right?
Uh-huh.
The resistance of
Yeah.
moving forward. And so,
Absolutely.
and you deal so much with that resistance and the blocks and everything that's loaded there in that resistance. But if you just take, is it about taking a step forward or a step back to sort of come into that place of neutrality? What are you saying?
I mean, I think it's definitely, so if we're starting out with sex negativity, right? I think
Mhm,
it's moving forward. So it's always,
mhm,
with coaching, right? It's always about moving forward and how can we move forward? So for me, somebody that is able to at least get to a point of sex neutrality, I think is a huge win, right?
mhm, mhm.
Only once we get to that point can we move forward to sex positivity. I
Yeah.
think it's hard to go from sex negative to completely sex positive. I think
Mhm.
that's the point that you become a little bit neutral.
I think what you're saying, what I'm hearing is that you create a lot more space. It feels very spacious,
Yes.
that area of neutrality. Yeah. And there can be, I've myself experienced in being coached, that idea of like, oh, you got to get to here and you got to do, check this off the list. And, you got to get to all these goal oriented points. But if there's so much resistance there, you're not going to budge.
Yes.
Right. So
Yes.
just creating this very spacious
Yes.
environment for moving into neutral, and then they're taking baby steps to
Yeah.
move forward. Such a
Mhm.
beautiful concept. I want to move on to another concept that you introduced earlier, and that is sensate focus. I love sensate focus. There's so many things that I love about it,
Oh, yeah.
especially as a tool to gently start making connection with ourselves when we're moving through perimenopause and menopause, when we're feeling so disconnected. Can you briefly explain what sensate focus is?
I'd love to explain. So, sensate focus is really, it's a practice. It's a practice that a lot of sex therapists will use. And I love it. I love my sex therapist friends. I think that they are so super smart and they just really understand the brain. And the reason why I love sensate focus is because it really is just a stepwise process. When we talk about that going from sex negative to sex positive, this is something that somebody
Mm,
can use to move to that sex positivity. So just to give a little bit of background on it. So it's a technique that originated by Masters and Johnson way back in the 60s. And they were the pioneering sex therapists. And it's a series of structured exercises that's designed to increase intimacy and sexual pleasure by focusing on the experience, right? So
mhm,
it's the experience of physical sensation without the worry of performance. So I think really that is the key. That last thing where we talk about experiencing the physical sensation without the worry of performance or goal attainment. Oftentimes when people have sex, when they're intimate, there's a goal of reaching orgasm or there's a goal of doing X, Y, and Z with your partner. How about if there were no goals, right? How about if there was no performance anxiety? So oftentimes when men have performance anxiety, right? Are they going to be able to maintain an erection, right? Are they going to have premature ejaculation? Do they have erectile dysfunction? When they're so preoccupied with those thoughts, and I don't really focus on men too much, but this has applicability to both men and women or any gender, really. And really, it's about not focusing on performance, right? So when you take that away, like I had somebody ask me once, it was the spouse of a woman that I was coaching, and he just asked me a question. He said, sometimes, and he was asking me this because I'm a coach, and so he was like just wondering. He's like, sometimes I'm not able to maintain my erection with my partner, and I don't know why that is. And then I just asked him simple question like, are you worried about performance? Are you worried that you're going to lose your erection? Because the more you worry about something, the more it happens, right? So if you're constantly worried that, this is going to happen. So when you're so worried about what's going to happen and what might happen, then I think that's kind of like a self-fulfilling prophecy. And so that happens. So if the partner is so worried about losing that erection, then they just focus on that. And then when that happens, they think the whole experience was a failure. So really Sensei focus is all about having the experience without the worry of performance or goal attainment, right? And it consists of little steps. And what you do is you're gradually progressing from non-genital touch to genital touch, and partners take turns. And so exploring each other's body. And so the way that it works is that you try this. So basically, if somebody's going to try Sensate Focus, they need to schedule it into their schedule about 2 to 3 times a week. Okay. And you want to allot at least 15 minutes per person for them to kind of explore. And what it is that you are going to really just you're not focused on arousal. You're not focused on orgasm. You're not focused on anything at all. It is simply touch. And that's what you're going to focus on. You are focused on, that's why it's called sensate focus, because you're focusing on your sensations. And what you are doing is that you are feeling the other person's body with your hands and your fingers for your own pleasure. I don't even want to say pleasure. It's really for your own, basically, exploration, right? You're
Mhm.
focusing your attention on the sensations of temperature, on texture, and on pressure. So what you're doing is you're looking at, what does their skin feel like? Is it warm? Is it cool? What is the texture of their hair and their skin like? Is it smooth? Is it rough? And pressure, is it, am I pressing hard? Am I pressing soft? And you're really not, this is all for you. And the reason why you're doing it, well, the reason why it's all for you is because you're embodying your body again, right? You're coming into your body. It's a way of mindfulness, incorporating mindfulness into your intimacy, right? You are seeing, what does it feel like when I touch my partner's skin with my fingertips? What does that feel like? What are the sensations happening in my body? You're not trying to arouse them. You're not looking for anything from them. It's all about you and really coming back into your sensations. And what you're doing is this touch of your partner is for your interest. And that's what's really important. It's not for their pleasure. It's not for anything else. And it's not a massage, right? So, sometimes people turn, it's not a massage. This is not because a massage is for somebody else, right? It's not
Mhm,
for
mhm.
you. This sensate focus is for you. And I think
Mm.
this is fantastic because when we have people, let's say, that were never sexually experienced prior to marriage, right? And that happens a lot in say in conservative cultures, right? You've never had sex outside of marriage. So all of a sudden now you get married. And then, you've heard these things that, oh, sex can be painful because sex is this, sex is that, or that you're supposed to have sex on your wedding night.
Mhm.
This takes away all that pressure. There's no you don't have to have sex if you don't wanna have sex. If you talk about this with your partner ahead of time and you tell them, or this is great for people that have experienced trauma, right?
Mhm.
People that have gone through any type of trauma. This is great because really what is it doing? It's reintroducing physical touch to you in a safe environment where you're able to, and actually, you're not supposed to talk to the other person while you're feeling, because again, this is for you. And you do a debrief afterwards, right? So you'll talk, and then the person will talk and talk about what were the emotions or feelings or sensations
Mhm.
came up for them, right? But you talk about it afterwards, not while you're doing it, because really it's the whole time you are focused on that pressure, on that touch, on that temperature, and just the sensations that it arouses in your own body. And the whole thing is for you. And then what you do is, you're not kissing, you're not doing anything. And like I said, you start with touch, the non-genital parts of the body, right?
Mm.
And then this is that we said, like, Sensate Focus is a stepwise process. So then, once that whole session you do, is non-genital, then you can get to genital touch. And eventually, if you want, you can go to intercourse. And that's a very last step. But it really is a graduated, stepwise process,
Mhm.
so there's no rush, there's no pressure, you're not
Mhm.
feeling that, there's no performance anxiety, and whatever happens in the body happens, and there's no judgment. And that's why this is, for me, it's combining sensations with mindfulness. What you're doing is you are really just being present in the moment without judgment.
I love that. You explained it again so well, Sensate Focus. I learned through Dr. Lori Brotto, who, as you mentioned, was on my show in episode 9, that this type of practice of connecting body and mind and being fully present.
Yeah.
She shares data on
Yeah.
from studies with hundreds of women, how this type of practice
Amazing.
has the benefit of improving desire, the ability to get aroused, improve
Mhm.
lubrication, and actually stay present to pleasure. Because as you know, and we know, Dr. Sadaf, we probably as women enter intimacy with that laundry list of things on our to-do list, right? And we're checking them off during intimacy. So I feel Sensate Focus, the way you explained it, is such a beautiful entry point to be present with ourselves,
Yeah.
to be present with another. And that is really at the core of intimacy, isn't it?
Yes, yes. And that's how you can deepen that emotional intimacy that most people crave. And when you talked about Lori Brotto, I just love Lori Brotto. And that paper that you reference is actually a paper that we read, and it talked about women that they had in group mindfulness practice for about 6 months. And they noticed when they practiced that mindfulness that it automatically increased lubrication, arousal, and libido in these women. And that really, when I was also talking to Dr. Rosemary Basson, who came up with that female sexual response cycle, she actually talks about how she doesn't even really believe in medication. She really believes in the mindfulness aspect of it, and how, they've done so much research to show that really just embodying your own body, being present, really just focus, that will help with the arousal. Because like you said, we have so many things on our plate. And when there is basically a misappropriation of household chores, right? So
Yeah.
women tend to be burdened with household chores. And so when that happens, then sex is just another chore, right? And so you're not going to enjoy anything that's a chore, but also there's already so much going on in your head, right? So that you're not really present. And if you're not present, you're not going to feel arousal. You're not going to feel the increase in lubrication, and of course, as we get older, we know that it takes a little bit longer to become aroused and to get lubricated and all that stuff. So all of those things being said, I mean, mindfulness has such a huge component, plays such a huge component with arousal and libido, and just really having that emotional connection.
The senses to me have always been such a incredible doorway for deeper connection with myself, with others. And I know this sensate focus can be a solo practice as well as a partnered
Oh,
practice.
yeah, absolutely. Absolutely. 100%.
This has been fantastic. So much learning in this conversation with you. Thank you so much, Dr. Sadaf. Please share with our audience how they can connect with you. Tell us about your new practice, your new concierge practice.
Yeah, thank you so much. And thank you so much for having me on. I really enjoyed our conversation together. There's so much value with just all the learning that you and you have so much experience as
And
well.
you're going to have to come back on, Dr. Sadaf, because We just only barely scratched the surface.
I'd love to come back on. So yes, I do telehealth. I do telehealth for New York and Michigan. I'm licensed in both of those states, and then also I have in-person practice that you can come into, and that's located in Chappaqua, New York. I have opened up my offices, and I'm accepting new patients, and I focus on menopause and sexual health, and of course, I do my coaching as well. So all of those things, you can come in and take a look, and I'd love to meet all of you. And I have a podcast of my own that Gabriella is going to be on. It's called the Muslim Sex Podcast. And also, I'm hosting a retreat in September 16th through the 23rd in Morocco. So I'd love to see
Oh,
everyone up. We only have a few spots left. And we're going to be focusing on menopause, perimenopause, sexual health, nutrition, all of that. It's going to be amazing. And lots of things. I mean, I'm on Instagram and TikTok at Dr. Sadaf OBGYN, and I have a YouTube channel and all of that. So I'd love to hear from people, and you can always DM me or you can contact me at hello@femvhealth.com. And my practice is called FemV Health. So it's women's life health.
thank you so much. Before we go, I always ask my guests, what does pleasure mean to you?
Oh, I know. It's such an amazing question, right? It's so hard to actually define, but pleasure to me is an experience where I am fully immersed in, that I
Mm,
can be vulnerable, that I can enjoy, that causes me to be happy and really just enjoy with all of my senses, because then I am really present and I can really experience it.
beautiful. What a wonderful note to end our conversation on. Thank you so much, Dr. Sada, for all your work, for just approaching this field of medicine, of sexuality, of human psychology with such an open mind. We do need more doctors like you. Thank you for your work in the world.
Thank you. Thank you so much for having me on. It was my pleasure. Thank you.
I hope you enjoyed this episode of Pleasure in the Pause. Want to help me spread more pleasure in the world? Hit the share episode button and send it to a friend, or post it on your Instagram stories and tag me, Gabriella Espinosa. And if you really love this podcast, please leave a rating or review, as this helps the show get in front of new listeners. Finally, if you would like to access even more pleasure and stay in touch, sign up for my free pleasure upgrade bundle of powerful mind-body practices by going to pleasureinthepause.com. Remember, your pleasure matters.